Today I want to talk about one specific grave danger during pregnancy that can and should be discovered early on. This condition poses a direct threat not only to the health of the child, but also of the pregnant mother. I should first explain where it all begins and how. This over here is the pancreas, an organ that is responsible for producing insulin, but also digestive enzymes that are then released into the duodenum of the gastrointestinal tract. It is a vital organ, and without its enzymes and hormones, life would be unimaginable. The function of producing insulin is incredibly important in order to transport glucose, which is a form of sugar, from arteries of the body into the peripheral and central organs, the heart, but also muscles such as the biceps muscle. Just like with everything else in the human body, something can go wrong here. And in fact, the human body can become resistant to the insulin that is produced in the pancreas, and a condition called hyperglycemia can develop. After that, the body can respond with an increased production of insulin from the pancreas. This also results in an increased concentration of insulin. And this, what I just described, is a condition called diabetes mellitus type 2. Up to 4% of the adult population in the United States suffers from this condition without even knowing it. The symptoms for this condition are rather subtle at the beginning, but the consequences and the damage it can cause can be devastating. Obviously, there are many pregnant women suffering from this condition as well, without even knowing it. And that is why I have to ask you to like this video and subscribe to our channel, because YouTube and other websites will only suggest our video to these women if we get enough of likes and subscriptions. Otherwise, our videos will not be suggested. It is really important to spread the awareness about this condition because it can cause permanent damage to the development of the child, and a newborn might be born with a condition called macrosomia. That is a term for an increased body weight and size of the child at birth, and in this case it is obviously caused by an increased level of glucose in the mother's blood. There is no more secure place in this world than the mother's uterus, and this fine separation of maternal and child's blood prevents transmission of diseases. The abdominal fat and muscles of the mother protect the child from the outer possible mechanical and thermal dangers. Yet not willingly and not knowingly, the pregnant mother might endanger the child's health if she's not aware that she suffers from diabetes type 2. These subtle symptoms and the damage that can be caused by this condition can accelerate during pregnancy, and the mother might develop a condition called diabetic retinopathy. The health of diabetic patients is under extreme stress during the pregnancy, and even women who don't suffer from diabetes mellitus type 2 can develop a form of diabetes called gestational diabetes. All these subtle symptoms and consequences that are hard to notice can accelerate and progress further during pregnancy. So, for example, increased levels of glucose can damage small arteries and nerves, and that way damage a very sensitive part of the eye called the retina. We define this as diabetic retinopathy. Similar process can take place in the kidneys, and medically we define that as diabetic nephropathy. The diagnosis of this condition is not that hard, but a lot of doctors are not internists. They're not familiar with the basic guidelines and criteria for diagnosing gestational diabetes or diabetes mellitus type 2. Going to a general practitioner who's not familiar with these conditions might not be enough to recognize it and properly manage it. Management of this condition is where it gets more complicated, and there are specific lab as well as clinical examination tests that should be performed. The treatment of diabetes mellitus type 2 in pregnant women usually involves the use of insulin in combination with healthy diet planning, and it can have incredible and amazing effects for both the child's and mother's health. Doctors and patients, we have something for you. If you're a doctor and you want to make videos like these, then go to anatomsky.com. But if you have more questions about diabetes, then go to symptomsky.com/help/diabetes.